That's good. Morning, John Dunn.
Good morning, Jeffrey.
It is that time of the year for your people.
Absolutely. It's what we live all year long for, Jeffrey, is to get to this time.
Every year it rolls around. What kind of well-informed decision are you going to make about your Medicare Advantage coverage?
That's exactly right. So this is annual enrollment period for Medicare Advantage or Part D drug plans, and it goes all the way to December the 7th.
So, and the good thing about this is you get several bites at the apple, John. So if you go, you have that conversation, and then you think about it, you talk with a neighbor, you have some conversations with your kiddos or maybe your grandkiddos, and you go, I think I'm going to go the other direction. You can call you can call your healthcare concierge at Health Team Advantage, the number 336-920-3648. They'll pull up your file.
That's right.
So you don't have to start over and you say, I've thought about it. I was going to go this way. Now I think I want to go this way.
That's exactly right. So this year has become more important than any year I can remember in the Medicare Advantage market. So many changes with other insurance companies. So I'd say if you're with another insurance company other than Health Team Advantage, you need to take a close look at what your benefits are changing to, especially there are big changes in the Part D drug program. So take a good look at your prescriptions and how they're being paid under your current plan. And you may need to call us at Health Team Advantage so we can look at how we would pay for those drugs for you.
Sure. And a healthcare concierge can guide you through that every step of the way. We can have that conversation multiple times if need be.
That's right. From beginning to end, you know, you may get some answers and you go home and talk to your spouse or your child about it and find out, oh, I have more questions now. So, it's okay to call right back in.
Yeah, it's not a problem. And what are the hours and the days where a healthcare concierge will be available?
7 days a week, 8 a.m. to 8 p.m.
What I love most about this, John, is that you're not starting over when you call Health Team Advantage. They get it. You got a life to live, and they're going to make this as easy as possible.
That's right.
So, all right, that's the number to call, 336-920-3648. There's also a ton of information on the website.
Yes, we have revamped our website starting 10/1, so a lot of new information on there. Quick, easy way to look up your doctors. If you want to do that yourself, or look up your prescription drugs, if you want to tackle that by yourself as well. But yes, a lot of great information there. A lot of information on the new drug guidelines that have come out for 2025. So, I mean, I can't stress that enough for this AEP and what's coming up for 2025. Look at those drugs.
Maybe you're just uncomfortable on the website. That's fine. A lot of us are. Maybe you'd rather sit down. You're a face-to-face person. You've been all your life. That's fine too.
Going back to the website, you're kind of like me, kind of a little ADD. If I'm not where I need to be in 2 clicks, I'm done. Checking out. Let me pick up the phone and call somebody, or come in person, like you said, to our local benefit center in High Point, 5815 Samet Drive.
And the hours?
We're 9 to 4. Monday through Friday. I'm usually there at 8. So if you need to do early, come see me.
So do you need an appointment if you want to sit down and have that conversation?
Feel free just to walk in off the street and we'll take care of you.
And so, folks, now this is where it gets really good. If you just bring your grocery bag, right, you tie it up, you put those handles in one loop, and you put all your prescriptions in there. Now, if you're like my grandma or my mama.
Yes.
It could have been 10, 15 bottles. And so you bring that in, and we'll go through that bag with your prescriptions and look up. So when you leave, you know exactly what your out-of-pocket expense is every month for your medicine.
That's right. And we prefer you to do that. We'd like to see the spelling, the dosage, how many times a day. It's good to have all that information right in front of us.
So, yeah, don't be embarrassed. Don't be shy. You can call back, get in touch again. Please don't hesitate and don't delay and don't put it off. Now, some people go, John, I'm not worried about that. When I turn 65, it's all just going to happen. True or false?
That's a big false.
Okay.
It's not just going to happen.
All right. So what
Part A may just happen.
All right.
Your Part A. But that's only hospital coverage under original Medicare. Have big deductibles, co-insurance, no maximum out of pocket. So those bills can just keep rolling and rolling. Part B, you need to be proactive and reach out to Social Security because you'll have to let them know how you want to pay your Part B premium. but that gives you access to outpatient services such as your doctor, your specialist, outpatient testing and labs. So it's a big deal.
Yeah, I need to go to the doctor. I need to get my checkup. I need a chest x-ray. I've had a cough.
That's
all that
right.
basic kind of regular stuff of going to the doctor. This is not some peculiar, bizarre thing that's only going to apply to one out of every 10,000 people.
Everybody.
This is all of us. Isn't it?
Everybody.
So
Yes.
you're going to need to have this conversation. Parts A and B, those are big deals. What about C and D?
So let's go into Part D next, because that's your drug coverage. Very important to have drug coverage. It is not part of your A and B. So this is something you have to reach out to a private insurance company and get a Part D policy to cover your prescription drugs. Now, there are guidelines set by Medicare that all of these companies have to go by, what they have to cover, maximum out of pockets for each member, but you have to be proactive and reach out to get one of those plans. If you do not, then you will start accruing a penalty that will go into play once you do choose a plan.
And when does that penalty go away?
Never.
Okay.
When you pass away, the penalty goes away.
It's a gift that keeps on giving.
That's right.
Or asking.
Yep. Now we'll come to the fun part, Part C.
Yeah.
So Part C takes Part A, Part B, Part D, and wraps it all up into one neat package.
So you just got everything covered.
Everything under one plan. And they also will kick in things that Medicare doesn't cover, such as dental, vision, hearing benefits, gym memberships. So there are a lot of these supplemental benefits that are part of Part C plans that are not part of original Medicare, and they pick up your drug coverage as well.
Well, say that, and that's got to be just a burden off your mind when you know that everything's been addressed.
And most of those plans, Jeffrey, is great because there's zero premium.
See, how about that? And then sometimes there are bonuses even, and maybe help you cover monthly expenses, right?
That's right. So most plans here in the Triad will include an over-the-counter card called an OTC card. This allows you to buy, things like vitamins, first aid supplies, allergy meds, cold and flu meds, those over-the-counter things that we can kind of go through pretty rapidly. You can use that OTC card to pay for those instead of coming out of your pocket.
Sure, that's good news,
Absolutely.
Right? More money in your pocket at the end of the month.
We all need that now.
The number to call for your healthcare concierge, 336-920-3648. The website, htanc.com. That stands for Health Team Advantage.
North Carolina.
.com.
That's
Or
right.
you can go see them at the local benefit center, 5815 Summit Drive, 9 to 4, Monday through Friday in High Point. Take your papers. Take your prescriptions, go and sit down, and we'll go through everything and get you on your way, right?
That's right. Bring everything with you.
Got it. So not a problem. You got questions. You want to repeat questions? Not a big deal, friends. You're
Not a
like
big deal
family,
at all.
So please get in touch. All right. Now, John, the annual enrollment plan rolls on through what date?
December the 7th.
Folks, you can go ahead and take care of this today.
Please take care of it today. Wipe it off of your list of things to do, get it behind you, and move on.
And isn't it great when you know you've made an informed, quality decision that's going to benefit you?
The relief. There is nothing worse than showing up at your doctor's office, maybe to find out they're no longer in your network, or at the pharmacy about ready to pay, and all of a sudden, well, that's not what I paid last year. Well, you didn't do your homework or let your agent do the homework.
There are always changes.
This year, there are more changes than usual.
So I heard a doctor say once that people are really only worried about three things when they go to the doctor. One is hurting,
right?
One is dying, and one is going bankrupt. You can alleviate those three. And when you connect with your healthcare concierge, or you call John and you sit down, you have these conversations, we can take that number 3 off the list. We can get you informed and worry-free.
That's right.
And so you have till December 7th. You can pick today.
Yes.
And then if you want to pick differently tomorrow, that's fine too. So Medicare, can I just wait until my 65th birthday?
No, that is too late. Medicare will go into effect the first of the month of your 65th birthday. So if you turn 65 November the 15th, your Medicare is really eligible for November 1st effective date. So if you wait until that 65th birthday, you're already behind the 8 ball. So, it 3 months ahead of time is not too early.
So go ahead and reach out Social Security, and
Yes.
then you start the process, and then you still got time. Even if you called today and started that, you would still have time to get your Medicare Advantage plan in place.
That's exactly right. And Medicare is not going to deduct anything for your Part B premium until the month that you're eligible. So if you take care of it 3 months ahead of time, you don't start paying then. You don't pay until the month of your 65th
It's just
birthday.
like some people go, well, John, I hear you talking, and that's great and everything. I don't have any extra money to have one of your healthcare concierges or an agent kind of talk to me through this. I can't afford to pay anybody else to do that.
There is no fee for any of that.
And then so that someone can make a decision that's best for them and their current financial and family and health situation. And if we need to do a conference call,
We'll do that.
with an adult child,
We're here to serve. And any question you have, anything we need to look up, whether it's a doctor or a prescription, we live for that, Jeffrey.
sure. And then they've been trained to it. Now, in the rare instance that you call 336-920-3648 and you say, can I speak to John? And John's busy,
Right.
we'll take a message and John will call you back.
Any of the staff is more than qualified to help as well. So, you've got you and your spouse and maybe an adult child on the phone ready to talk, and John's not available. Talk to whoever is, because we can all do the same thing.
This is not just a job. It literally is a calling.
That's right. It is.
You have to feel it. There has to be some compassion there and some knowledge and some wisdom and experience. And that's what you get at Health Team. Not another myth to prove true or false. I don't need to worry about it because Medicare covers anything.
No, that is another big false thought out there. Medicare does not cover everything.
I wish it did.
That would be nice. We pay into this system our whole working lives, but there are a lot of gaps in Medicare. A lot of cost share that gets pushed, deductibles and co-insurances, and no stop loss in place. So you need a plan in place that's going to take care of those things for you.
What if I miss the enrollment?
If you happen to miss it, we have open enrollment, which is January the 1st through March 31st.
Okay.
Now, that open enrollment is only for people who are on a Medicare Advantage plan, Part C, or a prescription drug plan, Part D.
Okay.
If you're on original Medicare and you decide January the 1st, hey, I think I want to try one of those Part C Medicare Advantage plans, can't do it during open enrollment. So let's stress, do not miss annual enrollment.
That's why we keep harping on December 7th.
Yes.
That's the day. Just circle that on your calendar because it really does matter. And another question, I don't even know if I'm eligible for Medicare. Or what do I need to have? What do I have to prove? What do I have to show?
I would say start off by calling us, and we'll walk through that with you. We'll look at your age. We'll look at your qualifications, because
it's not strictly 100% age-based.
If you have been on Social Security disability for 24 months, you're eligible. A lot of times that disability eligibility will get backdated. It goes all the way back to when your effective date for Social Security disability was determined. It may have been 18 months ago.
Right, because it's not unusual for somebody to apply for disability and get turned down.
That's exactly right.
You have to go through the process, and by the time it plays out, it could be your disability is retroactive.
Right.
2.5 years ago.
Yes.
It could be.
So now all of a sudden you are eligible for Medicare.
Right. On the turn of a button.
Lou Gehrig's disease.
Sure. ALS.
Automatically eligible for Medicare.
Okay.
End-stage renal disease. Automatically eligible for Medicare. That's one of those things that may just happen overnight, Jeffrey. It can be a quick diagnosis.
And all of a sudden, this is your way of life now.
Right.
So, but you don't have to navigate that alone. It can be overwhelming. It can be intimidating. We'll cry with you, and then we'll get some Kleenex, wipe away the tears. There is a future and still a life to be lived.
That's right. And then we'll go into problem-solving mode and get you handled.
What about diabetes? We often don't think of it as being a disability.
Right, because so many people have their diabetes under control. But at Health Team Advantage, 5 years ago, we looked at that diagnosis because our team of doctors felt like, hey, we can really help diabetics in the triad if we design a plan specifically for them. We rolled out a brand new plan for diabetics or people with congestive heart failure. It's called a chronic special needs plan. But if you have one of those diagnoses, especially diabetes, we are well equipped to help you not only maintain that condition, but a lot of times we're able to better your life living with that condition.
Bob is on the phone.
All
Bob,
right.
I got a question for you. Hey, Bob, thanks for calling. What's on your mind?
Okay, good morning. I think in your advertisement, one thing it says is eligibility is based on re-enrollment. Can you explain that?
Eligibility is only based on your Medicare eligibility. So if you have Medicare Parts A and B, you're automatically eligible to apply for a Medicare Advantage plan.
Okay. And then also, my wife is 80, and I'm going to be 77 shortly.
Mm-hmm.
So is that too old to join your plan?
Absolutely not. You can join our plan at any time. There is no maximum age. As long as you have the eligibility for Medicare A and B, so you have your red, white, and blue Medicare card, and you see your Part A effective date and your Part B effective date, you're eligible regardless of age.
Okay. And all of our medical doctors are with Wake Forest Baptist System. And I think you cover that. Is that right?
That is correct. So Health Team Advantage is owned by Cone Health and Novant Health jointly, but we have so many other systems in our network like Atrium Wake Forest Baptist, UNC Health, a lot of the independent doctors and specialists who are not part of any of those systems, we have contracted and in network.
And for example, we've had a supplement plan for several years now.
Mm-hmm.
And of course, our premiums, keep going up every year. And we're paying for the medical, for the prescription, and also we have a separate dental plan.
Right.
That's we pay every quarter.
Mm-hmm.
How do you calculate whether you come out ahead with an Advantage plan versus a supplement plan? Of course, you don't know what your medical expenses are going to be.
And what I look at is, okay, what is the customer paying for their Medicare supplement? What are they paying for their Part D drug coverage? And then what are they paying for their dental or vision coverage? Add all of those up for the entire year. And if that is more than what a maximum out-of-pocket is for a Medicare Advantage plan, you're already way ahead of the game. Now, another thing to keep in mind is very few people on Medicare actually reach those maximum out-of-pockets on a Medicare Advantage plan, but you are guaranteed you're going to keep making those premium payments on your supplemental, your dental plan, and your Part D drug plan. You're paying them regardless of how much or how little you're using those benefits.
Right.
But the easy math is, does all of that added up? Does it come in less or more than a plan's maximum out-of-pocket?
Okay, and it seemed like there was something in the news not too long ago that people on Advantage plans were going to have more out-of-pocket expenses. Is that true?
That is not true. That is, there are a lot of things that are out. I've read a lot of articles. I've seen some YouTube videos on this specific topic. The bottom line is, Bob, we all, whether it's a Medicare Advantage plan or Medicare supplement plan, we all have to pay or play by the same rules that CMS puts out for Medicare. So that is a myth. We all operate under the same rules, but you do have some Medicare supplement agents who only sell Medicare supplement, or you may have a Medicare supplement insurance company that puts out this information. And a lot of times what they talk about is it's harder to get a procedure or a device approved under a Medicare Advantage plan than it is a supplement. Just not true, because we all operate under CMS and their guidelines.
Okay. And is it true that if you switch to an Advantage plan and for some reason you're not happy with it, it's almost impossible to go back to regular Medicare?
No, that's another myth that's out there, and it's a scare tactic used by those same agents that once you opt in, that you can never come back, Bob. Not true. So this is what annual enrollment period is for. It is true that once you go on a supplement plan, if you stay on our Medicare Advantage plan, if you stay on that longer than 1 year, there are certain insurance carriers for the supplements that you may have to go through underwriting. But there are also other Medicare supplement plans that have no underwriting, meaning they're guaranteed issue. So that's a myth. There's always an opportunity to get back to a Medicare supplement if you're just completely unhappy. I can tell you, of 22 years of doing this, I've never once yet had anybody switch back that has moved to an Advantage plan.
Wow.
Not saying they don't exist, but I just haven't personally experienced that.
Okay. And then I guess my last question, I'll let you go. When you switch to an Advantage plan, then we would not have to pay the Part B premium. Is that right?
No, you would still pay the Part B premium. You just would no longer have a premium for your plan that goes with that. So like right now, you have a premium for your Medicare supplement. You would not have a premium for the Medicare Advantage, but you would still pay Part B for both. The only time you don't have to, or you exempt it from Part B, is if you qualify for Medicaid as well as Medicare.
Okay. Well, I appreciate the information. I think I'll probably be giving your office a call and talk to some of those folks over there.
Mm-hmm.
Give us a call and we'll go over it and help you make the best decision for you. Before we wrap up, John, we were talking about the chronic special needs plan, and some of the highlights of this are the premium and the deductible, and you get the enhanced benefits. Can you run down that list, why this is such a good thing?
Yes. So on that plan, we've designed it with a low maximum out of pocket. We've designed it with zero copay for your primary care specialist, a zero copay for your specialist that's treating your chronic condition, whether it's your endocrinologist for diabetes or your cardiologist or your podiatrist. We've kind of enhanced the benefits for psychological care because that's a need in that demographic of people. We've added things like Papa Pals that will send out, and just, you don't have to have a medical condition to trigger this benefit. It's a companionship benefit. You need someone just to come out, talk with you, sit with you, watch TV with you, do a little light housework, take you to a doctor's visit or to the grocery store. It's got that benefit built into the plan. So it goes above and beyond your normal, what you would think needs from medical.
When you talk about insurance, we don't really talk about the human connection, and maybe that should be at the top of the list, because we're not dealing with policy numbers and diagnosis. We're dealing with people.
That's exactly right. That's a good way to put it, Jeffrey.
So there you go. I'm gonna start working part-time. Health Team Advantage.
You know it like the back of your hand now.
Some folks may be listening online this morning, and then they call and they find out I'm not eligible because of my county of residence.
That's possible. We are in 33 counties in North Carolina, but call us, find out, and then we'll let you know, if you are in a county we don't service, we can send you in a direction for help as well.
And another big question is my doctor in your plan? That's a phone call away also.
That's right. We'll be glad to look up any provider. And we're always contracting new providers. So if you give us a name that is not in our list, we're more than willing to reach out to see if that doctor will contract with us.
Sure, because that's a fluid list.
It is.
And doctors move. So that's always kind of in flux a little bit. So the number again to call for your healthcare concierge at Health Team Advantage, 336-920-3648. The website, htanc.com. John, you'll be back here in just a few days, right?
I will be back, Jeffrey.
Looking forward to it. We got a ton more on the pop quiz.